right, with that, I will get started on providing our update for the MPRINT Maternal and Pediatric Precision and Therapeutics Hub Data Model Knowledge and Research Coordination Center. I always forget to introduce myself. I think most of you know me by now. I'm Sara Quinney. I'm a professor of obstetrics and gynecology and clinical pharmacology here at IU, and the PI for the DMKRCC, along with my co-PI Langley, who also leads the knowledge base in Portal Core. Also pictured here is Rob Bies, who is my co-PI for the Pharmacometrics and Clinical Trial Design Core. And then Sean Granis and Chris Bartlett, who along with Anita Mendoko have really spearheaded the real world evidence core. So I'm going to give an update on some of the logistics and outreach components, and then we'll give updates from each of the other cores as well this morning. So as part of the MPRINT RFA, there was funding set aside every year to support opportunity pool fund support. And for the first 4 years, we placed a RFA out inviting people to provide proposals for use of this funding. During that time, we made 22 awards, and almost $2 million was awarded, of which $200,000 went to trainees. And I really want to give kudos to my grant management team, Kevin McClellan and Paulette Kiley, who were responsible for all the subcontracts, dealing with no cost extensions and emails from people saying, when's my carry forward going to be available? And really, taking the brunt of the logistics for these opportunity pool awards. I reached out to our awardees recently and asked them for some information on how they've used, what this funding has resulted in and what it has meant to them. And you'll see some of the information here from many of you in the audience or who have been here previously this week, such as Tamara Lewis, who used the award to facilitate a retrospective study to prepare for a prospective study looking at precision dosing of drugs in the NICU. And so this grant allowed support to build the infrastructure, which I think took a lot longer and more work than she anticipated, like it always does, and is now being used to support some pilot papers, and also there's a grant under review through Health Canada for that. Tomiyuko Mizuno received one of our first-year awards to develop a maternal PBPK model of buprenorphine, which supports precision therapeutics for neonatal opioid syndrome, withdrawal syndrome. And this has led to multiple publications. He supported a graduate student who is now at J&J continuing work in maternal pediatric therapeutics, and has been contributing to subsequent grant applications in this area. Teresa Casey at Purdue collaborated with Christina Chambers on an opportunity pool award a couple of years ago, and this has already led to the submission of an MPI R01 this last February. They're anticipating 3 manuscripts, one of which is currently under review, and it also has supported a postdoc and PhD student, and notably the postdoc has already been offered, and I may have already accepted the tenure track faculty position. One of our trainee awardees, Elizabeth Thompson at Duke, was excited that this award then was able to provide her some information and data to support a successful K-23 application focused on pediatric therapeutics research. She's also gone on to, I believe, obtain some additional funding, and is, as we heard from her earlier, being very productive in this area. I've been working closely with both John Wagner and Brian Overholtzer, who are listed here, on some projects. John's funding allowed him to obtain pilot data on pravastatin and sildenafil in patients with Fontana-associated liver disease, which has led to 7 national, regional, and local presentations. and served as preliminary data for an R01 submission. He's also put in several American Heart Association and other foundation grants, and it's been supporting one of our graduate students' work as well. Brian Overholtzer has supported 2 PhD students. We heard from Omar earlier this week on some of the work that has been done in his area looking at QTC prolongation in pregnancy. They've presented posters at regional and national meetings, which have won some trainee awards. And then there's been a meta-analysis that's currently published, and I believe at least 1 manuscript under review, and maybe another one as well. So, and Jess, who's in the audience now, has also contributed to these projects. So you can ask him for more details. And we have Janet Markle from Vanderbilt established a new collaboration between 6 labs spanning between UCSD and Vanderbilt, leading to 1 publication. Has another manuscript under review, and has supported a postdoctoral fellow who remains active in the maternal pediatrics therapeutics research area. Laura Ramsey was at Cincinnati Children's when her grant was funded, and has now moved to Kansas City. Her work supported a PK study of sertraline, and was able to show that CYP2C19 and CYP2B6 affect pharmacogenomic effect in kids. She notes that CPIC recommendations had recently been published without including any pediatric data for the 2-gene combination recommendations, but her data made her feel comfortable implementing the recommendations in pediatric patients. So I'm sure they're already being implemented at both Cincinnati and Kansas City, and a paper will be forthcoming that will allow others to feel supported by these. And you can see here the list of additional faculty and trainee awards. We heard from Artem on his work with ribsoboling and methadone, Stephanie Stansel on her work using 19F MRS imaging to assess drug distribution into the brain. Sun Yang presented earlier this week on her work with vitamin D in pediatric patients with cancer and the effects of that. And then you can see a list of trainee awards, and many of these trainees have remained in the maternal therapeutics research area, so I think that counts as a success for our grant program. I'll also make a mention of our COPPER collective online perinatal and pediatric repository. Chris Phillip presented on this earlier in the week during a lightning talk on the work there. So COPPER really allows us to have a centralized database where researchers who have biospecimens can provide information about the biobank specimens they have and what information they have. So these are more like, I have 500 specimens from first trimester women, healthy normal women, or something like that. And so we can use those then and reach out and see if they have more specific information. So recently Chris conducted a feasibility study on early onset preeclampsia. Of the 17 biobanks in COPPER at the time, she contacted them. I think 5 of them had samples, and 112 unique participants with samples of early onset with first trimester plasma samples, who later went on to develop early onset preeclampsia, were identified from these 5 sites. So as she noted in her talk earlier, this sounds like a small number, but for a rare condition such as early onset preeclampsia, this is a pretty large number, and it would have taken many trials, prospective trials and recruitment to obtain that number of patients. So I invite everyone to submit their biorepositories to COPPER. It's really simple. We just ask for maybe your protocol, contact information, and some general information about what's in the biobank. Finally, moving on, one of the goals of MPRINT over the last 4 years, and something I've spent and others in the team have spent a lot of time doing is developing connections and collaborations. So you can see here kind of the breadth of networking we've done, and I'm sure this is not everyone we've talked to over the last 5 years. And I'm just going to highlight some of the primary collaborations and outcomes from these. So I mentioned the opportunity pool funding. Last year, instead of putting out the RFAs for faculty, we were asked to support PregLac prioritization and other emergent needs within the NICHD network. You can see here the team, largely from Ohio State and Dr. Langley's lab, as well as Emily and Amelia from my group that were involved in these processes. So a few years ago, RFI was placed for nominations of drugs to assess for use in pregnancy and lactation. It resulted in 136 nominations in 8 therapeutic areas. I am sure we have now discussed way more than 136 drugs in these 8 therapeutic areas. So we split the data into those 8 working groups to focus on each area. More than 60 participants supported these working groups. Between them all, the working groups had more than 28 hours of discussions over 10 months, and I know Aditi and Summer and Shijun have put a lot more time into the work in creating multiple revisions, receiving feedback and information from NICHD and working group leaders. You can see here some of the work that went into it from the knowledge base that Lang may talk about a little bit more later was to identify gaps in information and what has been studied on these drugs. And so they use the Silver knowledge base to identify pharmacokinetic, clinical trials, and pharmacoepidemiology studies on each drug. And you can see here just an example of one of those. And in many cases, the lack of information on drugs, and this is on statins, which may not be currently used in pregnancy, but interestingly enough, on drugs that are commonly used in pregnancy, there are often very little information about their use in pregnancy. Many had no PK data, very few had clinical trials. So they also did manual curation for the gold knowledge base of over 1,800 papers that were put into this PregLac prioritization. So I understand the final report is nearing completion and will be shared with us soon for further revisions, and hopefully will be available shortly. We've also, over the last year, supported LactMed. This is, of course, the lactation database maintained at the National Library of Medicine. It's also available as a LactRx app through Tina Chambers' group in San Diego. Here we've worked to support Phil Anderson, who has been curating information for LactMed for many years. And then we are also evaluating at Lang's group and others that whether AI can facilitate development of these LactMed summaries. So, 10 years ago, we had very few studies being published every month on lactation pharmacology, clinical studies and PK studies. Positively, that has really increased over the last few years, and it's going to eventually get to a point where it's going to be difficult for a single person to continue curating. So we've been looking at whether AI can help facilitate these summaries, and also gaining some feedback on whether it's as user-friendly as the LactMed database. So more to come there. MPRINT has also been supporting the NICHD Clinical Pharmacology Trainee Network, or Captain Network, with Leslie Samity Bates this year. I'm going to give kudos to Amelia Grant, who's put a lot of work and effort into keeping the Wednesday webinars series going for them. We had some struggles over the fall and changing platforms and making sure some of the training was available for our fellows and students through the webinar, and so I'll give credit to her for navigating those issues, and really to everyone who's been watching those, I thank you for your flexibility as we've had several changes over the last year. I think now it's being, the last semester's done pretty well, and most of the talks are now posted also on our YouTube page and made freely available outside of the community as well. Finally, we've been providing a lot of clinical trial infrastructure support to NICHD, and you'll hear more about this as Rob and I give some updates from the Pharmacometrics core at least. So we've had several study design consultations for the leveraging network infrastructure to conduct innovative research for women, children, pregnant and lactating women and persons with disabilities. Proposal, I know we've supported at least 4 requests for that. One of those has resulted in a funded application and a collaboration between the MFMU and MPRINT to support a study called PregDose to look at optimal dosing of understudied drugs administered to pregnant women per standard of care. So this is currently in the protocol development phase and will be moving towards IRB submission soon, and incorporates not just sites within the MFMU, but both the KRCC sites at Buffalo, IU, Purdue, as well as UCSD. You can see here we've also had several collaborations that will be talked about with Pediatric Trial Network, Impact, HPTN, and the Global Network. Finally, just a brief comment about some of our outreach and education efforts. Again, this has been something that I think has been really valuable, and reaching out to trainees and early career investigators to provide education in maternal pediatric therapeutics. In this past year, we had hosted a symposium at the American College of Clinical Pharmacology meeting in September, where Lang, Rob, and I talked along with several of our other colleagues here, Angela Birnbaum, Kevin Watt, and Ram Venkat from Pittsburgh. And then Rob and I supported a position statement on medications in pregnancy and breastfeeding that was just released by the British Pharmacological Society through an international effort of many of the leading people in the field. Here we see a picture from a blog that was made last year following our annual meeting. And as you all know, we pivoted to a virtual platform last year. And this individual from Katrina Waite's group provided a blog about how that was beneficial to those in Africa and other countries, and really appreciating the interactive opportunities they had to participate in the Google Docs. So our reach is definitely beyond the US and into international waters there as well. And then finally, here we have pictured a group, mainly I think IU, Buffalo, and Ohio State students who participated in a summer school led by Bernard DeBono and Peter Hunter that helped us understand how we could utilize common data fund information in the ecosystem to support mechanistic PK/PD modeling in our area. We also have been active on outreach online. Our MPRINT Hub website has an average daily visit rate of 16 users. We have over 500 listserv members who receive our regular emails advertising webinars, seminars, and then providing a newsletter of activities. And we also have a very active LinkedIn community with 720 followers there. So feel free to like and follow us, sign up for our listserv. You can find all the information on the website at mprint.org. We also have been building our YouTube channel. For the first few years, we did a live monthly or twice monthly webinar in some cases. And what we found was that we had very poor attendance during the live sessions, but then we would get a lot of views online. And so we've transitioned, especially as we've been supporting CPTN webinars this year, to building more of a online presence and placing videos online. Really, one of the things we're focusing on is developing an MPRINT Academy, which I'll talk about later. So really looking for options for shorter videos that provide foundational information for maternal pediatric clinicians who may be interested in doing research and not have the experience, but also then for our researchers to learn more about the clinical components that are involved in this research. So you can see we've had 11,000 total views. I think Josh Unadcat's video still stands as the top viewed video on it. And then over 600 hours of people watching our videos. Okay. So over the next year, one of the things we're going to be focusing on is really expanding this outreach and education component. As I mentioned, continuing to build the MPRINT Academy and focusing on training activities for early career investigators and students and fellows. We are also working in expanding our group involved in this effort. Krista Longton is a faculty member here at Indiana University. She's actually a member of the Department of OBGYN and Communications. Like me, she's one of the few PhDs and not MDs in OB, and is involved in a lot of outreach and support. So she's really being instrumental in helping us with some of the communication science, as well as way down Cal, who's at Ohio State in Lang's group and has expertise in communication and has been supporting some of the work they've been doing in getting feedback on the apps that are in the LACTMed database that's being developed. Erin Curry is a MFM here at Indiana University who has an interest in lactation and specifically in lactation education. And she's developed a Life Raft program that is bringing lactation education to mothers and over at Riley Hospital. And she and Emily have been working together to develop surveys to help us identify information or gain data from breastfeeding mothers on their views of pregnancy or medication use in lactation and the information that's available. So, I hope over the next year, we're really going to expand some of these programs and bring in the community engagement, not just of our research community, but also of our patient community to assist in better designing studies. And one thing we plan to do, and I've been working with Krista on, is to develop some focus groups that will help us evaluate the utility of the knowledge base and further develop that. So several of you in the audience may be reached out to in the near future to help participate in those discussion sessions. All right. With that, I will transition to discussing some of the work we've been doing in the Pharmacometrics and Clinical Trial Design core. Here you see the faculty that have been involved, and this core really spans both IU, University of Buffalo, as well as Purdue University. As I mentioned, Rob Bies is the co-PI along with me on the pharmacometric core. Also at Buffalo, we have Wojciech Krzansky and Deval Shaw providing faculty input. Here at IU, Tom Callahan and Mike Heathman have been instrumental. I tell everyone that, my name goes on the papers, but for the POP PK, Mike, as well as Brian Overholtzer, are the real drivers behind those studies. And then Brian at Purdue, along with as I mentioned, many of our graduate students. So just touching on, I know a lot of these studies have been talked about during the first couple days of our conference and during the lightning talk sessions. So I'm just going to give kind of an overview of some of the projects we're involved in, and invite you to, if you want further information, to speak with the students and trainees that are listed for them. One of the collaborations we've made is with the Pediatric Trials Network, where we are supporting the analysis of the POPs study drugs. So this was a pharmacokinetics of understudied drugs administered to children per standard of care. And we heard earlier from Jacob about some of the work he's done with haloperidol. Omar has completed analysis for lidocaine, and they are both working on now the report and manuscript development for those. Rajaram from Buffalo has been working on vancomycin, and I think is probably in about the same place to start writing the report, or maybe has been writing the report. And then Michael Grutfest, one of our T32 fellows, is been offered to take on our next example using using propofol data that was collected. So this has been a really valuable collaboration for us, and I think, looking forward, we'll continue to grow the work we've done with the DCRI team, as we've also developed some additional grant supports together. I mentioned earlier the MFMU PregDose study that was funded as a collaboration between MPRINT and the MFMU. This again is an opportunistic study to assess changes in PK and PD across gestation, and it will utilize the MFMU clinical sites for clinical trials where we will be studying 10 drugs in at least 100 women each across gestation and in the postpartum, to evaluate the change in PK, as well as collecting information on the pharmacodynamic outcomes of the drugs. So then within the MPRINT Hub, and also using Kevin Watt's group, who was the prime driver of this, I know Kate Job's here as well, she's been involved in some of these studies. We will be helping support pharmacokinetics, so PBPK, PD, or PK-PD modeling, with the goal to really develop some app-based infrastructure to support individualized dosing of these drugs. And this is my last slide, then I'll pass it over to Rob. Again, we have lots of other things happening here at IU and Purdue in the pharmacometrics realm. Here I've listed many of the trainees and junior faculty who have been involved. Omar Abashetti working with QTC prolongation in pregnancy and evaluating the effect of hormonal change on QTC interval. Lindsay Kirkpatrick is a junior faculty in the pediatric infectious disease division, who is interested in utilizing real-world data to study azole antifungals. Suhas in my group is looking at labetalol in pregnancy. He talked about that earlier this week. As I mentioned, Peggy is working on the project with Jonathan Wagner, looking at pravastatin pharmacokinetics in pediatric and specifically FALD populations. Jacob has been working not only on the PTN project, but also looking at he has plans to look at some glucose modeling in pregnancy. Aislinn Pross was a former fellow who has worked with dexmedetomidine in pediatrics. Jess Rafa is looking at using more of an in vitro approach to look at cardiac and myometrium physiology, working with Brian. And then Amber Rogers, as she talked about earlier, is looking at metformin in modeling in pregnancy, specifically looking at the placental transfer of metformin and exposure, and then also has done some analyses on the CYP3A changes that are published, and kind of a meta-analysis on that. So that's what we're doing here. We will take questions after we have all the speakers for this morning's session. So I look forward to answering your questions. And with that, I'll turn it over to Rob Bies from University of Buffalo.
Thank you, Sarah. So I'm Rob Bies. I'm a professor in the Department of Pharmaceutical Sciences at the University of Buffalo, and serve also as the Associate Dean for Graduate Education, and then the co-director of the Pharmacometrics and Clinical Trial Design core with Sara. So I'm going to take the next few minutes to talk about some of the collaborations and projects that we've been involved in a little more directly. So this is Yifan Yu, who is a PhD candidate at the university, and he helped put together a model-based meta-analysis with basically all of the publicly available data for TAF, TDF, and FTC in pregnancy, and published a unified model here in Clinical Pharmacokinetics earlier this year. You see the identified shifts in terms of changes from non-pregnant individuals by trimester and in postpartum period for both TDF and also identified TAF bioavailability changes. You see that there were many groups that contributed data. Johns Hopkins, the Conrad network, HPTN, MTN, Impact, and he also identified that with TAF administration, if we are interested in the peripheral blood mononuclear cells, even though the tenofovir concentrations are lower, and you see them, they shift down in pregnancy, the actual diphosphate moiety, considered to be the active moiety, is maintained at a much higher concentration level, potentially conferring protection that wouldn't be reflected by just the tenofovir peripheral plasma concentrations. And this was actually a 5-fold higher tenofovir diphosphate concentration versus TDF administration. Yifan was also then took this information and the shifts observed and implemented a model to look at the risk of infection after dose in pregnant people after administration. He made the assumption that the tenofovir diphosphate and FTC triphosphate were the surrogate markers that drove the protective effect here. This again was a collaboration with MedStar Health at Georgetown and Johns Hopkins, actually, as well as Max von Kleist in Berlin. And you see the risk profiles here shifting, but largely overlapping here with respect to the impact of pregnancy on risk here. And again, the key thing here we were showing here is the predicted prophylactic efficacy from 1 pill a week to 7 pills a week. And you can see once you get to about 5 pills a week, we're really above the sort of efficacy threshold of interest. You can see that there's very little certainty in terms of the protective efficacy at the lowest levels of adherence, and adherence is really the primary driver here. Part of this uncertainty comes from the assumptions with respect to a risk event occurring, for example, and whether or not drug intake occurred relative, in close proximity to a risk event or not. Yifan was also involved with HPTN 083-084 sub-studies led by Ethel Weld at Johns Hopkins, and was exploring predictions with respect to the level of protection and the number of adolescents that would maintain a trough concentration above the PAIC90 and 4-time PAIC90. And using a purely Bayesian approach, showed that depending on key assumptions with respect to incorporating data from other sources, that you actually get somewhat different answers in terms of the level of protection here. And so what we see here is the predicted trough concentrations from these. If one uses only the adolescent data in a simplified model, uses a full Bayesian model, or actually pools the adult and adolescent model. When you pool the adult information, it actually draws the predicted distribution for protective concentrations down, predicting a higher proportion of individuals below PAIC 90 and the 4 times PAIC 90. And this manuscript actually is about to be submitted. So another partnership was with Sharon Nachman. This was an investigator-initiated study and an opportunity for those of you who heard Mukshada's talk earlier in the week, her lightning talk on the platform PBPK model for monoclonal antibodies. This was a study related to monoclonal antibody use in asthmatic children, applying clesrovimab for that purpose in 1 year to 6-year-old children. Data were available basically in children up to 1 year of age and in adults. So we were able to adapt actually this platform model, first calibrating it using adult data, and then scaling it and evaluating the performance in the available data for the 1-year-olds, and then scaling up to the 1 to 6-year-old group. So we were able to make a series of comparisons here a priori. So we won't know until if the study is funded, we'll be able to confirm which one of these sets of assumptions actually holds. So we did we took a population PK model from the literature that we scaled beyond the 1 year of age data that it was developed for, and this is the green line here. I should say the blue line. The green line is a scaled PBPK model. And the yellow line is a PBPK model without scaling for the FcRn-driven degradation rate constant. And you can see that they predict somewhat different periods of protection in terms of maintaining concentrations above a key threshold of 10.2. So we're able to explore this, and hopefully we'll be able to confirm this with the study results. We have additional collaborations with the University of Washington and MedStar Health on a KPK model for TAF-T, DF-FTC in African subjects, really looking primarily at evaluating dry blood spots, dry blood spot-derived concentrations, and whether or not we can use those to come up with a similar adherence algorithm that has been developed by the UNC group. We continue to support for IMPACT the 2050 CREATE study, a phase 4 study for the pharmacokinetics of long-acting injectable cabotegravir and rilpivirine in pregnant and postpartum adults with HIV, and also a study of long-acting cabotegravir in breastfed infants, primarily focusing on the 6-month to 2-year of age range. Other collaborations that were stewarded by Dr. Krasansky include the Helio study concept proposal for NICHD with Heather Frey, and a second NICHD grant proposal on L-arginine for the prevention of hypertensive disorders with Matthew Hoffman at Thomas Jefferson University. So we've also developed some tools. So Mukshada and Deval published this platform model. And we've seen some of the interfaces that have been made available for this, and this came out earlier this year. This is the platform model that was adapted for clesrovimab to support that study effort. In terms of the evaluating long-acting injectables in breastfed infants, Yifan actually created a PBPK model with a R-Shiny interface in conjunction with Edmund Caparelli as well, evaluating, or that allowed us to evaluate different dosing paradigm, age groups, and expected concentration thresholds that would be achieved. And this is manuscripts in preparation. We expect when that manuscript is accepted, we'll post the software on GitHub. And then Wojciech has been involved in the cohort population analysis of sparse data, focused on dexamethasone pharmacokinetics in mother and fetus, based on blood sampling at birth. And this is under review now at the Journal of Pharmacokinetics and Pharmacodynamics. So as Sara highlighted, We're going to continue to expand the MPRINT Academy, provide training resources and support to the community, as well as continuing our collaborations and support for study proposals and study pharmacologists in these various networks, including MFMU, Pediatric Trials Network, Impact, and HPTN. And with that, I'll conclude and thank everyone for their attention. Lee Lang is next.